Hello, and welcome to the State of the Science Research Summit. I'm Kevin Mills, the Chief Scientific Officer for the National Hemophilia Foundation, and it's my pleasure to welcome you to day 3 of the summit. We've had an incredible first 2 days of the meeting, and I really anticipate another day that will be filled with thought-provoking discussion and dialogue. In the first 2 days, we heard many of the challenges and the research priorities that pertain to specific bleeding disorders. And today we're going to turn our attention now to issues and topics that cut across all bleeding disorders and really affect the community broadly. Among these challenges are the issues relating to inclusion, diversity, and equitable access to both healthcare and to research, and the inclusion in research, and the need to put our best ideas and theories into practice. To kick us off today, to discuss this incredibly important topic, it's my pleasure to welcome Esmeralda Vasquez. Esmeralda is a member of the bleeding disorders community. She was diagnosed with Glanzmann thrombocythemia, an ultra-rare bleeding disorder, at the age of 1. Since then, she's developed a deep interest in matters of healthcare equity and improving and increasing healthcare access and working with underserved populations, particularly in urban settings. Importantly, Esmeralda has also been a member of the steering committee that has really guided us through the planning process for the State of the Science, and has been an important member of the working group on diversity, equity, and inclusion and health equity. Importantly, Esmeralda will be sharing her thoughts with us today in Spanish. So for those of us who don't speak Spanish or whose skills are a little rusty, please remember you can always use the translate button that can be found at the upper portion of the meeting room. It's also a terrific pleasure to welcome and to introduce Dr. Carrie Norris for our plenary session, our plenary speaker today. Dr. Norris is the Vice President for Health Equity, Diversity, and Inclusion at the National Hemophilia Foundation, and is a very skilled public health professional who's had extensive training and is highly accomplished in the field of health equity, health promotion, and disease prevention, and has worked tirelessly at the local, state, and federal levels. Dr. Norris is a graduate of Agnes Scott College and has done training at the Morehouse School of Medicine, the University of South Carolina, and the Emory University Law School. Dr. Norris additionally serves on numerous boards for healthcare nonprofit organizations, is an accomplished author, and is a TEDx speaker on health equity. So there's nobody better to talk about the issues and the opportunities that sit before us to strengthen the inheritable blood disorders community and the capacity to advocate for optimal health for all. After that, we will move into the session for the working group, which will be co-chaired by Dr. Tyler Buckner at the University of Colorado and Dr. Vanessa Byams at the CDC. And then that will lead us into what I hope will be another robust and thought-provoking panel discussion moderated by Dr. Melissa Creary from Athens.